As we move into the 11th month of the coronavirus pandemic, the numbers of patients we're treating remain high and the pressures you are all facing are as prevalent as ever. Today, we are treating around 140 COVID patients, some of whom are no longer infectious but still require care for the longer-term impact that the virus can have on the body. 13 of these patients are in ICU and a number remain on oxygen support on our wards. In addition to our COVID patients, we're experiencing high numbers of non-COVID patients, and the time that these patients are waiting to be seen in the emergency department is still higher than we would like. Encouragingly, we are seeing a slight downward trend and our numbers have decreased in the last 2 weeks. This may be the impact of lockdown coming into effect and the impact on the case rates. The latest data indicates that Swindon's case rate is now 247 per 100,000. Where we were the second highest in the southwest, we are now below the average, which is great news. What we definitely know is that the incredible work that has been done internally to discharge patients as quickly and as safely as possible has made the situation feel a lot more manageable. Of course, we must keep this momentum going and work continues around the trust to identify patients for discharge, who are then supported by a number of teams to have a discharge plan in place, medication and transport organised, and an onward bed located if needed. While our position is marginally better than it was, intense pressure is being felt across the area, with high numbers of patients being treated across the region. Hospitals across the region, along with ambulance service, are extremely busy, and we continue to hold daily calls with our partners and are working more closely as a network than we have ever done before to respond to this challenge. Across our organisation, a number of corporate staff have stepped forward to support in clinical areas to help wards manage the pressures. They have also been joined by new and returning volunteers, and my thanks go to every one of them who have stepped forward to help. 20 different areas, including COVID wards, Sunflower Ward and other clinical departments have welcomed the new staff, who have supported with admin roles such as updating patient information on our digital systems or helping with basic patient care such as handing out meals or supporting with virtual visiting. Over the last 2 weeks, 143 shifts have been filled, of which 63 were by volunteers and 80 were by staff. These volunteers will remain redeployed until Sunday, and the need for this kind of extra support will remain under constant review. We have also had a number of clinical staff redeployed to support in areas of high demand, whilst their usual services are postponed. Working in a new and unknown area is never easy, but I've heard positive feedback about both how welcoming the teams have been to new staff and how appreciated the support has been that those redeployed have given. We're also continuing to hold regular calls with social care to identify any support that patients need following a discharge, including home help or a bed at a local care home if necessary. We have been inundated with messages of thanks and praise for the smooth running of our vaccination clinics, both at the hospital and across our primary care network. My thanks go to every single member of staff who have worked so hard to make the rollout such a success. There is still a long way to go, but nationally around 4 in 5 over 80s have now received their first dose, as well as a large percentage of over 70s and the clinically extremely vulnerable. And these numbers will only increase in the coming weeks and months as we redouble our efforts. As the anniversary of our first COVID admission draws ever closer, I'd like to take this opportunity to express my sincere thanks to every member of staff, wherever you work in the organisation. My thanks also goes to our local community who continue to be incredibly supportive and encouraging. When staff are feeling tired, your messages of support go such a long way in rallying morale and lifting spirits. We need everybody to keep playing their part to stop the spread of infection. Wash your hands, cover your face and maintain social distancing where necessary. These simple rules are the only way we can truly stop the spread of infection. 2020 was the most difficult year we could have ever imagined, and much of 2021 will be difficult too, but there is some optimism for a normal future by way of the vaccine. Stay safe and look after each other. Thank you.